screenings for mouth cancer like other cancer screenings? If so, how often should they be done, and which specialist should I see?
Great question, by the way. Great question. So, one of the things that we do as dentists, and anytime you come in for your routine care to our dental office, either it could be like an exam or like a regular cleaning visit. We always do an oral cancer screening. So we don't just call it as an exam, we call it as a or a consultation. Either it is an exam and an oral cancer screening, or a consultation and an oral cancer screening. And we do a variety of things. And sometimes patients may not be able to appreciate that because we do that real quick. So when we are doing it when we are seeing any type of patient, what we are looking at is, we are not just looking at the teeth or the gums, and we are looking at whether they have cancer inside the mouth or whether they have cancer outside the mouth. Either the cancer inside the mouth, we call it as an intraoral cancer, or intraoral cancer risk, or extraoral cancer. And also we are looking at the jaw joint. So these are the variety of things that we do. And to answer your question, how often it needs to be done, it needs to be done as often it needs to be done. So sometime it could be as low as 3 months, or it could be 6 months, or you're the judge of your own person, right? Just like I normally tell this to patient, particularly if you're a high risk person, just like women are so educated to feel their breast and make sure that they are not feeling any lump on their breast. The same way, look around in your mouth, look around your face to make sure that nothing has changed from the day previous to today, or week previous to this week. And then if there is any change, talk to the dentist. And we got a lot of patients, they walk in, they are self-aware. Hey doc, things have changed from last week to this week, can you look at it? And I have an ulcer that has not been healing for over 2 weeks, and then we immediately recommend doing a biopsy, meaning take a sample of that. So to answer your question, it has to be done as often as you could, or needs to be done.